Welcome to the HC Biz Show, the podcast dedicated to unraveling the business of healthcare. I'm your host, Don Lee, and we are coming at you live today. We're letting you see a little bit of behind the scenes of how we make a podcast episode. Normally, we're recording this, going through editing, generating it all out, and putting it out to you a few weeks later. But we're going to do both this time. We get a bit of a hybrid model. And joining me on this experiment today in live broadcasting is my friend, Dr. Steve Ambrose. Welcome to the show, sir.
Don, I am so happy to be here. I'm looking forward to the next hour or so, and ready to roll.
All right, so we are broadcasting live, as I said, on Twitter and YouTube as we speak. I can see them working on the monitor, so beginning of our experimentation is off to a fantastic start. And thank you all for being here with us today. Obviously, if you're listening in a little bit later, you can track all of this stuff down on YouTube. We'll have it all cleaned up and ready to go there if you're listening on the audio feed. But just real quick, for anybody who's new to us here today, the HC Biz Show started back in 2016, actually as a live show. It was more of a live call-in web show, if you will, on a platform called Blab. And we did a couple months of shows that way. It was a lot of fun. It grew up, got a lot of attention. We were getting really incredible guests to come on the show. Like spokespeople from CMS were on there with us on live Blab feeds. It was kind of incredible the way it worked out. That platform went away. We fell back into an audio podcast, which is, if you're a longtime listener, what you know and love today. And we've got about 165 episodes out there on Apple, Spotify, Stitcher, wherever you get your podcasts. And typically, I have a co-host, Shahid Shah. He unfortunately could not be here with us today. He's recording episodes right now for a conference that's happening next week that I just want to share a little bit about here today. That's the Health Impact Live Spring Forum. And this is, as Shahid puts it, the no BS, no PowerPoint show. And it is really just a collective of healthcare leaders who are out there doing stuff today, talking about what they're doing. It is, it's really fantastic content. We've shared some of it on this feed before that you might be familiar with, but you should go check that out. Health Impact Live Spring, and you can look that up and get registered. It's happening next week. So with that, we're going to dive into today's show with you, Steve, and we're going to be talking all about pricing, cost, healthcare consumerism, really a lot of things that you hear in the news, lots of buzz, lots of promise, and it all sounds really great, right? We're doing things for the patients. That is the whole purpose of healthcare in the first place. And as probably all of you know, it is an incredibly complex environment. It's really, really difficult for patients to navigate. And there's a lot of people doing great work, a lot of companies doing great work out there. But this stuff ain't easy. It's not just going to come together. And that's what we're going to talk about today. We're going to talk about some of the challenges that are out there, Steve, some of the solutions that you see on the market today. And we're just going to kick that around and share with the audience our perspectives on where things are headed and where we expect there to be some roadblocks in the months and years really ahead. So with that, Steve, I want to hand off to you for a bit of an intro. Just let the viewer / listener know, who are you, what's your background in healthcare, and you know, how did you get here to what you're working on today with this focus on consumerism and patient experience and all of the things that you're working on?
Well, Don, thank you. Thanks for the introduction, and I'll just say a little bit about myself. Let's keep it under 20 seconds if we could. I have 25 years in healthcare. I was a clinic-owning healthcare provider. I saw up to 60 patients a day in my practice. And years ago, back in the 90s, I was employing consumerism in patient care journeys and education and empowerment. So this is one of the areas we're going to talk about today, consumerism, near and dear to my heart. In 2014, I actually decided to leave practice and go more into the business community, even outside of healthcare, working for a financial technology company as a VP of strategy and of customer success. I worked there for several years successfully. I also ran, like you, a healthcare media show with top leaders called Red Hot Healthcare. We still have our episodes up, and then I've also do a fair bit of consulting for clients. in healthcare today. And I have to say that right now, these three subjects we're going to talk about are not only hot in the industry, but they're hot on my mind. And I really think, too, for a lot of people out there that are coming into healthcare that are somewhat new in the last 0 to 5 years, I think this is hot on their mind as well. And so this ought to make for a tremendous show. You can always connect with me on LinkedIn. Please feel free to go to my profile. Some of the things we'll talk about today are in my profile, some of the articles I've written, some of the pieces I've had. And I guess we're off and running from there.
Yeah, right on. And what I love about this subject and what I love about it specifically for this show is that we're always talking about confronting the realities of the business of healthcare. And that's why I said right at the beginning, like, it sounds great. And it sounds, we're going to have price transparency. We're going to have patient engagement. We're going to do all of these things to make it a better experience. And we have to do those things, but you can't just say you're going to do them and slap them out there. The reason the healthcare industry is the way that it is today because of a zillion conflators that will make it really difficult for you to figure out how to make this stuff work. And that's what we're always digging into. It's like, what are all of those issues? What are those competing priorities? What are the counterintuitive reimbursement models that are making organizations do the things that they do or not do the things that they do? And as we get into this stuff with price transparency and costs of care and and the real patient engagement and patient experience, we need to understand, as innovators, we need to understand and be able to work around, through, alongside of, with those issues. We can't ignore them away, or you're just going to be another kind of also ran, your innovation never got off the ground, and you're just left frustrating thinking nobody in healthcare actually cares. And that's just not true, Steve, right? And right. You have the medical background, you know firsthand what it means to go and, get into this world to care for people, but you also know firsthand what some of those restrictions are and some of those pressures that you face as a provider are that prevent you from doing some of this stuff. So that's long-winded, but that's what I love about this topic, because it is absolutely something we have to do, but it is not a slam dunk. There is a lot of work to be done and a lot of difficult issues to be tackled. What would you say to that from your perspective with that hands-on experience?
Well, first of all, I'm probably somebody that tends to get into even more taboo topics around healthcare price, because everybody seems today to be talking about price transparency. I'm talking about the high prices of healthcare and lowering them. And that's something you never hear in healthcare. You never hear about lowering prices as a consumer catalyst, as a driver, like you would see lower prices in any other industry. And if you just take a look at healthcare over the last 60 years, not only have the costs gone up, Don, the prices have skyrocketed through the roof on everything. And it's very interesting. Zach Cooper, who's a economic sort of an economic expert in healthcare from Yale University, said, with healthcare today, we have just amazing care, amazing people, amazing innovation wrapped up in a sea of dysfunction. And I think that describes it pretty darn well right now with what's happening. I mean, there's lots of great gems coming out on the technology side. There's lots of money flowing into healthcare. There's improvements being made, certainly, in care experience and care quality. I know there's a lot of emphasis now with health systems and hospitals around that. But the real elephant in the room here is price. And it's very interesting that pricing in healthcare is really a taboo topic. I've had this discussion with so many leaders, Don, down at HIMSS, on my show, and I'm going to tell you, they don't want to talk about it. They don't want to talk about it because that really is, to me, the linchpin that holds all this together. It's, I can give this study to anybody who wants it. They can just reach out to me. But in 2018, there was a researcher from Harvard Medical School, Ashish Jha. You may know who he is. And he put out a study. I can't believe that JAMA actually put it on their site, but they did. And this study really, Ashish Jha went in and he dispels a lot of the common misbeliefs and misunderstandings around cost and quality in the U.S. And he lays out some incredible underlying facts and figures. And one of the things he comes to the conclusion on, and I've not seen it anywhere else, is he said that pricing in healthcare in all areas, pricing of services, pricing of coverage, pricing of supplies, pricing of drugs, pricing of everything is way too high and is a direct contributor to the extent of all the costs we have and the cost issues we have. So today you talk to anybody about healthcare prices, Don, and almost always there will be a flipping that occurs. You see it in the media, you see it with healthcare leaders, you see it with PR people. They flip the term healthcare pricing, which is a consumer-centered term, to healthcare costs, which is really a business term. So watch that magic happen, because they don't want to talk about price. And that is a major linchpin. And as we're going to get into today, when we talk about consumerism, that is exactly where retail health and non-healthcare consumer companies are tapping into. So they're tapping into a sweet spot that healthcare simply wants to avoid and sweep under the rug. They always have, and people are drifting to it.
Yeah, right on. And the reason they don't want to talk about it is because there are no good answers. And the answers that would have to be given to the questions of why does this thing cost this much? Why does this MRI cost $2,800? The answer to that question is not good, and putting it on the cover of a newspaper would not be good for the healthcare business. And they don't want to answer those questions. And now, to your point, though, and the quote you gave is perfect, because in no way am I suggesting that there are people out there on purpose who are leading healthcare organizations and leading hospitals that are just trying to screw us because they can. This system and the incentives, this is where you always hear the term perverse incentives. Like, there are some real perverse incentives that make it almost impossible for anybody to do it differently, or at least, I shouldn't say almost impossible, but they make it very difficult, because it is usually a bad business move to do the right thing. That's one of the things we say all this time on the show, is like, there's no business case in healthcare for doing the right thing. And that's what makes this shift so dramatically difficult. So you mentioned it's not like the topic here is not price transparency, but that does have a component to all of this. And I'd like to at least just to address that before we move into the actual like high prices and some of the tools that are out there to address that. Is the price transparency, again, sounds great when you say, all right, we're going to print out, or we're going to make available all of the negotiated prices between health plans and hospitals, and we're going to put them up on websites, and then patients can go shop, right? Well, it's a great concept, except for we have almost no tools to help us do that. Almost. If we're talking about some, we have almost no tools to help us navigate that. The data is, while there's a standard way to report it, it's all different, and it's difficult to understand. It's difficult to make sense of. You have to know where to go get it. And then what are you going to do with it as a consumer, especially if you're in like an emergency situation where you have to make a decision about a surgery that you have to have in 3 days? Right. Like, that's not a good environment for being a consumer. So while it sounds great that this stuff's going to be published and there's all kinds of hoopla around that, it's really just like maybe a step in the right direction. It's one tiny component to what really needs to happen here to have any actual impact on these sky high prices that you're talking about. Would you agree with that assessment?
I would even add to it. And I'm just, listen, for the people who are listening to this, and I know that, this is not necessarily something that, it really is the elephant in the room. It really is operating in the shadows. And when you shine a light on it, there's a lot of people that don't want to address it. And they don't want to address it, let's say leaders on health system sides and that sort of thing, because like you said, there's no easy solution. Couple things. First of all, let's realize that at least with the American Hospital Association, they really don't want price transparency. Again, to the point we made before, they don't want any light shined on pricing or any focus on pricing. Price transparency does that. And so what winds up happening here is they fought this, Don, as you know, tooth and nail. Not only American Hospital Association, but many healthcare provider groups fought this tooth and nail going through the courts. And it had to be appealed, it had to be reappealed, and they finally lost. Now that it's in place, what we don't have are a number of things. We don't have real teeth in the penalties. First of all, it's $300 a day if you don't comply. Candidly, that's a joke. You should make it $30,000 a day, because $100,000 a year to a hospital, and certainly a health system, is nothing. It's nothing to them. And at the end of the day,
Agreed.
It's not enough to be a deterrent. You've got politicians that, quite frankly, may talk out of one side of their mouth about we need to make healthcare transparent with the prices. On the other side, they're taking money from providers and drug companies and payers. Because let's not forget, 2021, January 1st, is when providers have to have transparency. 2022 is when payers have to have transparency, right? It extends to payers. So what we're not seeing is hospitals largely putting this into consumer speak. The other thing that's not happening too with this, and I think it's very important, a good friend of mine, Jordan Johnson, who runs a company called ONCOspark, which I would strongly recommend people go to, and we'll talk on that in just a sec. There's no connected pieces of care. Like if you go in and you have a sprained ankle, right, and you're a consumer, what are you going to look up? Are you going to look up, sprained ankle and here's your cost? No, it's not all rolled into an experience, right, Don? It's You got to look up what's the E&M code, what's the X-ray code, what sort of in-hospital medication are you getting? What about the wound dressing? What about the facility fee?
Yep.
And of course, it's not all bundled together. So it's not really transparent pricing. It's just enough to barely get the ball started. Candidly, it falls far short and is almost meaningless for the average consumer. So to me, I think you've got hospitals and health systems that largely don't want to do this. Candidly, they don't. And I also think, too, it's not being broken down in a way that's really consumer friendly. We think it might be because, well, we put the codes up there and we could take the machine language or the machine format and put it in some human stuff. Nobody goes through and reads these things, component by component. You wouldn't buy
my
a
wife
TV
actually
set like
tried
that.
once, and it was ridiculous. When she was pregnant with our third child, we were trying to be good healthcare consumers, and I know a bit about this business. And she was on the phone with the health plans, and she got basically the list of CPT codes that would be getting billed, and it was like for prenatal care. There was she had like 5 pages of CPT codes, and they were not in any particular order, and they were not bundled in any way where it was like, well, these ones are for the lab and these ones are for the doctor. It was just literally just a dump from the health plan. And frankly, the health plan was shocked by the questions she was asking to begin with.
Right.
And
They're not
to
used
their
dealing with
credit,
consumers.
yeah,
That's
to
the
their
deal.
credit, the rep did their best to try to help, but they had no tools on their side. Like, this is just not something that happens. It's not really supported. And frankly, after a couple weeks of frustration, we kind of just gave up and we rolled the dice like we all do when we go get care, right? And we're like, well, we're just going to go to our regular doctors and we're going to go where they tell us to go and go to the hospital and hope things work out. So like that's your pretty much your best case scenario today in healthcare.
And you made a great point before, John, just to interject, and I just want to follow up on it. It was a great point. Healthcare is set up as a for-profit model. Even the nonprofits largely many times
Oh
make
yeah,
more
yeah,
profit than the for-profits, right?
yep,
You've got essentially what's coming to a head. You've got the chief driver of any business. The chief principal driver is profitability, and that is running up against mass unaffordability. That's it. That's in a nutshell. And
yep,
everybody's trying to scour around and try to look at quality of care, patient experience, what's our ratings with this or that.
yep.
You can't sweep it under the rug. These two are budding together. And the fact of the matter is, you've got 6 decades worth of this in healthcare. And how would you unravel it? How would you unravel this? And for people that say, let's just go to single payer, really? How are you going to take this massively interconnected system, Don, that has the largest employment pool of any segment, even more than the federal government?
Yep.
And how are you going to unravel it now and
Yeah,
make it
right on.
like that? What's going to happen to all the people employed? What's going to happen to all the stocks of all the companies that have been built up over
Yeah.
decades that are intertwined? You know what I mean? So,
Oh,
so
100%. The ramifications of that would
yeah,
be completely immeasurable because now you're going outside of the crazy complex healthcare system as it is. And you're saying, in the context of our global economic system, what happens when you change this model in the largest economy in the world? And I couldn't even begin to fathom what that would look like. And, frankly, like the conversations that are being had at the federal level in Washington, again, are not about price, and they're not about making any of this stuff cheaper by and large, right? There is, CMMI, the Center for Medicare and Medicaid's innovation model, which has done some good work over the years and generate some models that are trying to improve costs or lower prices. But that's really not the conversation that's being had. Really, at the federal level, they're just talking about who's paying for all of this. Like it's astronomically expensive. Who's paying for it? Are we the federal government paying for it? And then at the end of the day, it's not even a question of who's paying for it. It's more of like, when are we going to pay for it? Are we going to pay for it up front and try to be proactive? Or are we going to wait until people are all jacked up and they're in the emergency room and, are beyond, kind of beyond any preventative help, and then pay way more in the emergency setting? So that's the conversation in Washington, which brings us to today's topic, right? Like, this is not something that the federal government is going to ever be able to fix. Not happening, right? So if we as an industry and as we as innovators want to make this better, if we want to improve the way the healthcare system works because we want our families to be cared for better, ourselves to be cared for better, and because we don't want healthcare to bankrupt our country and completely put us all out of business, we're going to need to do something about this. And that's what we want to talk about today, because there are innovators in the market today with real solutions that are live, generating value, that are starting to chip away at this stuff in various ways. So let's shift into that now today, past all of the, accepting our doom and gloom reality, and say what is being done and what are some of the best opportunities or the best attempts at making a difference in this that you're seeing in the market today.
Yeah, the only thing I would add to that before we leave this conversation is that I know we were going to touch on this a little bit, so I'll just touch on it very, very quickly. And that is that most people really have no idea how prices are even set. They really don't. And if you look at almost 66% of the money that goes into healthcare every year, if we just look at provider services, if we look at charge masters that are hospital services and all the things that go along with that, right? The products, the supplies, the drugs in-house, the equipment, the facility fees. And then if you look at drugs and the list pricing, all three of those that make up nearly 2/3 of money spent in healthcare for pricing, all of those are privately set. There are very little, if any, controls on any of them. And I think, even though I'm not a big fan of government, I may be more libertarian in my thinking, I do think that the government, if there's going to be any real change that the government can do that the individual can't, I think it needs to be in these processes of how prices actually are set from the beginning peg on those three areas. That needs to change, and change drastically if we're ever to have prices come down to reasonable levels. So I'll just say that, and people can reach out to me. I'm happy to share them more data on that. But it is that is a very well covered up secret that unfortunately contributes to a lot of the issues in pricing.
Yeah, right on, right on. It totally does. So let's get into the good stuff here. We're talking about pricing. You've identified a few companies that you want to bring up for discussion here today that are doing interesting things that you think could be helpful. Where do you want to start?
Well, just as far as pricing goes and price transparency, one company in particular, I'm just looking it up on my screen here because I took a little notes on it. I'm actually connected with this gentleman, and I would strongly suggest people reach out to him. He is a real maverick in this space here, and his name is Jordan Johnson. And you can find him on LinkedIn. He's pretty active on there. His company is called ONCOspark, and they just came out with a whole new tool called a value price. And essentially, this is not just a whip together, application. They've got doctors on staff. They've got medical economists. They've got advisors, key advisors, and they've put this together in a way where not just hospitals, Don, but hospitals, all provider groups, vendors in healthcare, as well as consumers and even payers can tap into this value price tool that they have. I'm looking at it right here. And it provides them with some really useful strategies as well as, real-time data geographically. Because as you know all too well, and I'm sure most of our listeners know, you can have two companies, you can have two health systems that are 35 miles apart. They don't even have to be from North Dakota and New York City. I mean, they could be 35 miles apart in distance, and they could have drastically different costs from their charge masters and whatnot on a whole number of services, right?
Yeah, and it could vary from health plan to health plan. You might get a really good deal, if you will, on a broken leg from this payer at this hospital, but a bad deal on an MRI, and then go to a different hospital across the street, and the exact reverse will be true. Which again makes it completely impossible to be a real consumer in healthcare because it's just there's just layers of complexity to dig through.
Yeah, absolutely. And so check that out. Check out Jordan Johnson on LinkedIn and his organization. They're terrific. I think Turquoise Health is another one that's looking at this as well in this space. I would check them out and what they're doing. Again, we're really in the beginning throes of this, but these are organizations that want to come in and they really want to help, and they want to help in a way where I think they're trying to honor the profitability motive of the hospital and health system, which, by the way, isn't a dirty word. It's not a dirty word. No. I think it's important they're profitable. I think it's important they exist. But these companies recognize that the job isn't getting done and probably won't get done if it's done internally at hospitals and health systems. And probably by next year, most payers, too, may be falling into the same need. So those two companies, in my opinion, are great starts, and I think people could learn a lot by going there.
Okay. We'll link those up in the, down in the show notes and on the recording once we post it as well. So that'll be true throughout. But pretty much everything we mentioned will be linked up down below. All right. So how about in the retail space? I know that's an area of interest. When we're talking about pricing, we can't rely on the big hospitals to, solve this problem themselves. But you have a lot of new entrants coming in, the Walmarts of the world, the Amazons, like all of these organizations that are coming in, and they're looking at this and saying, well, this is ridiculous, right? Like, we can't do it. And they started with their own employees because first it was ridiculous for them as the customer, right? The employer who's paying the healthcare for their hundreds of thousands of employees. It's ridiculous. Let's solve it. They've started to have some success there, some really good success stories coming out of, Walmart's, Amazon's, Boeing, a whole bunch of them have had really good stories. But now they're saying, all right, let's turn this outside. If we can do it for our employees, we can do it more broadly. Am I right? So what do you see in the retail space
Oh,
that's exciting to you right
this
now?
is a tremendous passion of mine for a lot of reasons. The first thing I want to do, if it's okay, and I don't want to have too long of a ramp here, but have you seen the movie The Usual Suspects?
Yes, of course. I love that
Okay.
movie.
And hopefully many of our viewers here have seen that movie. But let's just say that in that movie, if you've seen it, I'm going to talk about the scene where at the very end, the police detectives, they basically step back from the board and they take a much wider view of what's really been happening the whole
Yeah.
time. That's the way that consumerism and retail care, and what I like to call the non-healthcare consumer companies out there, this is what they're doing. It's so interesting, Don. It's so interesting. The other day I was listening to a podcast. You would definitely know the podcast host, and a huge, well-known consulting leader in healthcare. You would absolutely know the guest. The guest has a name that if you're in healthcare, it's on your top 10 as far as a healthcare leader, system leader. And I have to tell you, when the subject of consumerism came up and they started talking about consumer and retail clinics, they both chuckled and they said, this is like a fad. We got to leave healthcare up to the health systems. That's their bread and butter. So I don't expect it. I'm telling you, I just shook my head. I shook my head so far back and forth this way, I thought I was going to get a whiplash. They're missing the boat. And the other day I read a post by a medical director of a very popular health system on the East Coast who said, these companies, they can't provide the same care that we can, the same in-doctor care, the same quality of care, the same, experience with patient journey touch points. And what I say to all this, Don, stepping back from the board like in the movie, right?
Mm-hmm.
That's not what these retail companies are trying to do. They are not trying to step in. In fact, they're not really, in my opinion, trying to be healthcare providers in any way, shape, or form. What they're doing, what the Walmarts and the Amazons and the Walgreens and even Best Buys, what they recognize is that healthcare is such an empirical part of a person's life that they're stepping into it as part of their overall experience they give to their consumers and customers. And if you notice, they're not hiring doctors. They're not hiring nurses. They're partnering. These companies are partnering, right? So when you see, for instance, if I'm just taking a look at my screen here, but we look at, Amazon and what they're doing with Amazon Care, right? They're partnering. They're going to have virtual care in all 50 states for employees by this summer. You look at Walmart. They just acquired MeMD. That's huge. And they think about this for a second with Walmart. Just a bigger picture here. What's one of the biggest issues we have in healthcare today? It's underserved communities. Yeah. It's social determinants of health. It's the classes of people in rural communities that don't have a place to go, right, Don? And you got Walmart. Walmart's got 5,200 stores. Where are those stores located? All over America.
Yep.
And what do they have? They have hundreds of millions of consumers. And what they recognize, and all these companies recognize, and I commend them for it, is they're saying we're not trying to be the next healthcare. We want to essentially control the front door. We want to control the initial entry point for consumers/patients that need front-level care or first response care, not emergency care, and we want to provide that for them in a meaningful way. Then we want to sort of like a data aggregator that you would have, let's say, a travel agency like Travelocity. Then we want to partner with secondary and tertiary care providers all around the country to hand these people off as our partners, right? Mm-hmm. So that's what this is all about. This is about not only meeting consumers head on with their needs, but it's also about recognizing that there's a big fight underway now to control the engagement side and the front door side of healthcare. And where healthcare is falling short or they're slow to start, this is where these companies have their expertise and their trust, years of trust. And this is what they're stepping into. And I would add, and we can go over the companies certainly, I would add really smartly that they're doing this.
Yeah, and it's a really interesting way to think about it, the way you just described, because if they're not trying to they're not trying to directly disrupt the hospital industry. They're not trying to replace what they are today, but they are fundamentally going to change the game if they are successful. Because if they can reach into these urban, these rural communities, these urban communities, all these underserved areas that kind of get into what I touched on earlier, where people don't have access to the primary care and the behavioral health and the preventative services that prevent them from becoming hospital patients that require that really high level, all the machines, all of the training, all of the expertise that you get from a hospital that require that. And then of course generates tremendous healthcare costs. A lot of those issues are going to go away. So they're not coming to take away or to replace you and the services you're providing, but they're going to provide a service that is going to eliminate need of the healthcare systems in the future. And, to the gentleman that you mentioned earlier, talking about this is a fad, like that's if I'm a hospital leader, health system leader, that's what I'm thinking about right now. Like they're going to eliminate the need that I serve. They're not going to serve it instead of me, which would be ridiculous. But they're going to eliminate a need of it for, I don't know, 20%, 30%, 50%, whatever. It's hard to say what it would work out to, but that's tremendous. And if you're not thinking about that as a health system right now, I think you're going to be in rough shape, because it's, you laugh at it until it takes 20% of your revenue away, and then it's too late to do anything about it. Right. So, and we know there are health systems that see this happening and they are out ahead of it. Those ones are going to get bigger and stronger and more successful. And the ones that are laughing about it right now are probably going to be toast, in my opinion, in the coming years. So
I think you're spot on. I think they are recognizing that. The leverage. I mean, one of the things to think about too is, just imagine that you get frontline care with Walmart or with Amazon or with Target, right? Or with AT&T, your cell phone company, because anybody can get into this space. Anybody can get into this space. All you do is you partner with a virtual care or telehealth company. And what are you doing? You're unleashing it on your consumer and customer base as an added benefit. And I expect this to continue to grow, not just with the Walmarts and the Targets. I expect other companies, Kroger, Albertsons, you name it, any company with a monster base of consumers and trust already. Why? Car companies, Ford, Chevrolet, why wouldn't they? It's like what they're doing is they're controlling their customer experience, and they're recognizing that they're going to go to healthcare anyway. They're likely going to go with virtual care growing to somebody's virtual care. Why shouldn't it be ours, right? Yeah. And then, of course, once they get that experience with the patient, they may not be using protected healthcare data. What do you think Amazon and Walmart and Target are going to do? You don't think they're going to reach out to these patients and say, maybe some of our other products that we offer could somehow maybe be useful here? Yeah. That's going to be a big Megillah to get through, but I guarantee there'll be court battles there. But don't expect that the care experience is not going to feed into their other things that they offer too, which is obviously getting to know their customer better, getting to offer their customer more, getting to make more money off their customer. You know what I mean? We talk about care journeys and care touch points. Let's not forget that touch points exist in consumer companies too.
Yeah, right on. And if they really do get that toehold here, and it appears like they are starting to, they're good at this, and healthcare is not. So if this, like, if they succeed in making this the game that's being played on a business front, like healthcare has no chance. There's no way they're going to be able to compete with a consumer company on consumerism. And again, that leads to don't laugh this off. If anything, take your value-based care models, your ACOs, your direct contracting entities, like those types of organizations, and start thinking about how can you partner with these organizations, right? Someone's going to go to Target or Walmart a whole hell of a lot more frequently than they're showing up at their doctor or their dentist. And
Right.
what if you can somehow incentivize that patient to get vitals taken while they're there, right? And you go grocery shopping and get your vitals, and there'll be some kind of benefit to you on that front. Now you're starting to close quality measure gaps. You're starting to do all of these things that we spend just massive amounts of money and effort on trying to do, and you're doing them in the natural course of people's lives, which is where you want to be if you're going to be successful. And then you're driving up your reimbursement, and you're creating more spread because you're lowering the cost for these folks over the long run. Like that's like, if you want to be thinking about how to take advantage of this, that's one area I'd be thinking if I'm running an ACO
Don,
or one of those. Yeah.
Brother, you are spot on. And what kind of a world do we live in today with prices and with costs? We live in a high deductible world today. We live in a world that more than for the last 20 years, right? Patient responsibility on payments have gone this way. And you know why healthcare is not doing a lot about it? It's very siloed. It's very presumptive. Right? We're the biggest. We've been around, whatever. Even the leaders, and many of the leaders are presumptive. They're not going to be able to compete with us. They're really missing it. And hopefully we can get into some of these companies on the retail and consumer side, because, I've laid out a bunch of them here that I'd like to go over. So
Let's do it.
Let's start with the top here. We talk about Walmart just a few days ago. I'm looking at my screen, so apologies to viewers that see me veer off here. But Walmart acquired MeMD. There's a little bit of expectation there's going to be pushback there on a regulatory front, but I would expect, and a lot of the experts expect, that they're going to sail through that. MeMD, what is it? It's a virtual care network for primary, urgent care, and, wait for it, behavioral care services. Yeah. So they acquired that organization that already does this all around the country, and now Walmart is going to unleash it into their consumers and their customers. So, and what else does it do? It complements Walmart's care centers. Amazon, what does Amazon have? They've got pharmacy. They've got PillPack. They've also got Amazon Care. And what's so interesting about Amazon Care, Don, and I know you know this, is they've got not only the virtual care, and they're selling this to employers, to self-insured employers, but they actually have at-home care too, that they can actually deploy an Amazon team to draw blood, to get labs from the patient's home, and they can deliver their medication as well right to the home. All of that combined in, again, like you were saying before, these people know consumers. This is their bread and butter for years.
This is what we want. Right?
This is what we want.
People want.
That healthcare is not meeting it. These companies are meeting it. Another monster, and this really is a monster, is GoodRX.
Oh, yeah.
I wrote a piece on this, and I would invite viewers, if you can, stop by my profile on LinkedIn, and one of the articles I have up in front is on drug pricing. GoodRx is front and center on a model that I think is going to be the next telehealth model, meaning I think it's going to be the next model that any consumer and retail company can bolt on, just like they're bolting on virtual care, Don. And that is, GoodRx is essentially a PBM extension company for consumers. They've inked deals with PBMs, and what they're doing, which PBMs, or pharmacy benefit managers, traditionally have never done, is catered directly to consumers. And so what GoodRx does is obviously they build a coupon site, a front-facing site. You don't even have to give your name or email or anything, and you can get a coupon on the fly, and you're getting the lower PBM pricing, many times lower than what PBMs are doing on your own health plan. People don't realize that.
Yeah.
And I wrote a great piece on this. I say that because it is a great piece, and it's needed. And I have to say that many companies, I expect, will be reaching out to PBMs. This GoodRx model can be duplicated. They don't have any secret sauce here. But I do think what they have is a big jump, because last year they made $550 million, okay?
Yep.
They've got over 5 million active users and growing very fast. And you know what their profitability is, Don, on that 550 million? 37% profit margin.
That's pretty solid.
30. Are you kidding me? 37% profit margin.
Yeah.
They make up to 15% every time somebody uses their coupon. Cha-ching. They get up to 15% kicked back to them.
Yeah.
Just by being a PBM extender. I'm not saying GoodRx isn't a good company. I know their CEO. I mean, I've communicated with him. Great company, consumer friendly. They've built a wonderful product and service. It can be duplicated. It should be duplicated. And this is, I think, a big linchpin to open up to people.
Yeah, right on. And with like
Yeah.
$500+ billion a year in drug spending, there's some room. There's some room in there for some savings and for some for some efficiency. And in your piece there, which I agree was a great piece. So you should feel good about your work. One of the suggestions you made was about, how do you take something like this and put it in line at the point of care so that the doctor can have a little bit of an exchange and kind of help guide their patient to the existence of these coupons and like where to go, because the prices are different at the different pharmacies around too. So where should we send you? And if you can combine that with something like a SureScripts has the real-time pharmacy benefits service, where at the point of care, they look into your health plan and they say, how much does it cost for you, Steve Ambrose, with your exact plan and your high deductible and where you're at within that high deductible. And it's like, it gets to the point of like, how much is this really going to cost you? Because it's going to be different for everybody, based on everything we've discussed so far. And then if you can combine that with also, here's what it's going to cost you. And here, by the way, the best pharmacy to go to is, this one or that one. And here's a coupon. Like, how'd you like that as a consumer? Compare that as a consumer to getting that script with no indication whatsoever of how much it's going to cost. And you show up at your pharmacy and you put it on there and they're like, that'll be $587. You're like, holy crap, 500. What are you talking about? There are so many scripts that happens and the patient just walks away.
That's right.
Now you want to get into medication adherence and all these patients aren't doing what they're supposed to be doing. And that's why I can't get my quality measures up and all this other crap that people talk about. That's that's happening. And it happens a lot. I don't have the stats in front of me for that one, but it's like, there's like a disturbing number of prescriptions that are just abandoned at the counter because of that. Like, it's like for many people, you ask them for $587 on the spot. That's just like, blood from a rock, man. That's like, it's not happening. There's no patient adherence issue there. You've asked them to do something that is impossible. You might have as well have asked them to survive without oxygen, right? So like, that's what, like, these are the types of things you put these tools together and they start to solve, not only they improve a patient experience, but they start to solve some of these really thorny business problems that behind the scenes we're all trying to solve in very roundabout, screwed up ways, because we're not just working with the patients on this stuff. So
what
there's good business sense here.
What did I say in the beginning of the conversation? I said the companies that unlock price are going to drive consumerism, and they're going to drive lots of money as a linchpin. That's exactly what GoodRx has done. It's exactly what they've done. And candidly, I think they are a great model because they have taken down that shield, that they have pulled up the covers essentially, And the only thing that has to happen now is it, like I wrote in the article and you just mentioned, you have to get it to the point of care with the doctor because of the
Get it
medication
where it
adherence.
matters.
I think I write in the
Yep.
article, I think it's 33% of all initial medication scripts are never filled. I mean, it's a ridiculously high
That is.
number.
Yep.
And is the doctor a real ally to the patient? Sure, the doctor's giving them great advice, great clinical care, great suggestions. The care experience is good. All that's great. But what about the price? And what
Yep.
about the doctor recognizing that and then being able to be an ally with the patient, right? Get on the same
Yep.
side of the equation with this and say, let's search for the lowest price for you here around here. We're going to use GoodRX, or we're going to use the SureScripts tool, or both. You could use both. Feed it right in through the EHR. That's,
Yeah, it's
that's
got to
what
be
I think is
seamless
coming
though, because
next.
because on the flip side here, like we can't just look to the doctors and say, "Hey, we found one more problem that you can solve, doc." This is, what I mean? Like this, what happens here in this model? Like this is a great model, but it also like the implementation of this, the execution of this has to be smooth. Like we can't rely on the doctors in this existing screwed up world where they're hopping from 15-minute appointment to 15-minute appointment, running 45 minutes late because not as many no-shows happened today as they expected. Like in this screwed up world that our doctors have to operate in, like if we want this to happen, it's got to be clean. It's got to be smooth. It cannot take them off of their path. It's got to be real easy. We have to enable the doctor to have this conversation with their patient in a productive way, an efficient way, and that's a hard part of this component as well. So
Yeah,
lots to think
and I'll
about.
yeah, well said. Well said. Enabling the doctor, enabling the patient, enabling consumerism all together. Couple other ones here. Another company that does this other than GoodRx is RX Saver. That's another one to look at. Another company to look at that is just getting early legs now is called Transcarent.
Oh, I love
That
that
is a
one.
company that is run by Glenn Tullman, formerly of Allscripts, formerly of Livongo. And this company basically, this is really something. What they're doing is they're coming in to self-insured companies, which, as you know, are the majority now.
Yep.
And they're coming in and saying, listen, take your insurer, whoever you have, and keep them. We're going to layer on top. And we're going to get paid on the back end of whatever we can save you. In other words, there's no per member, per employee, per month, none of that stuff. We integrate in, and they integrate in with no premiums, no copays, no bills for any recommendations and services given on their behalf to employees. And they're already driving down costs with surgeries. I mean, something like 50 to 70% I read recently for orthopedic and spine surgeries. That's just the initial foray. And then they've got heavy chat engagement. It's all risk-based contracted, Don, but basically what they're saying is pay us nothing up front. We'll only take from what we save you, and we're going to be able to be like a true ally to all your employees where we can steer them to the best quality, lowest priced, there's that word again, provider and service need. And, what they're essentially doing is they are acting as a consumer liaison to every employee. So Transcarent, keep an eye out for them.
Yeah, before you move off of them, that's just to touch on it a bit more, is they're doing that piece that we said earlier, right? When we were talking about price transparency, making the stuff available to the consumer, to the patient sounds great, but they have to know how to manage it and navigate everything. And that's basically what this service is doing. It's saying, hey, employer, let us come in and navigate on behalf of your employees. And we're going to find the best place for them to go have the surgery, or we're going to help them go get second opinions on things that, that they've been recommended. And we're going to be their partner, their care partner. We're going to help them get the best care they need at the best price possible. And they're able to look at this holistically, right? Because they have that expertise. This is the part no consumer is ever going to be able to do this without help. So that's the gap they're filling. And the fact that they're doing it at risk speaks a lot to their confidence that they can navigate, because there's a $2,800 MRI and there's a $700 MRI, and they work pretty much the same, and you just got to drive down that way instead of down that way to get it. Like, they know that they can steer it. They can basically take that spread and put it back into the company, right? And this is where your health plan costs stop skyrocketing, and you stop, making it so that employees can't have raises because healthcare costs went up, if you in the early 2000s, so they're going up 12, 15, 13% every year. It was insane. But that, like, this type of thing allows you to kind of find your way through the muck and get that efficiency and keep that money within the company and hopefully back into the employees' pockets in the long run. So that's why I really like that solution. And it's based on concepts like we've seen Walmart have success with their employees and their centers of excellence. Like, they'll take an employee who needs a surgery and put them on a plane with 2 of their family members and put them up in a hotel in Cleveland or wherever the best place is for the that heart surgery they need or whatever it is, and they'll pay for all of it. And it's cheaper, monstrously cheaper than if they let them just go to their local health system that's not as good. And that costs
And
more.
on top of the cheaper, the results are better at these centers of excellence.
Yep, it's
back to work faster.
100%.
All of it.
So,
the quality of
that's
care,
the way to do consumerism. We need a lot of help as consumers to be able to be good consumers. That's my point. I think this model. I think this is a model for the future. I think Transcarent really has something there. I'm excited to see what they do in the coming years.
Yeah, me too. And let's not forget, you and I both know this too, but let's not forget, when we talk about consumers, we're not just talking about patients, we're talking about employers, self-insured employers. Oh, yeah. They're consumers too.
Absolutely. Yep. They need tools too. Everyone needs tools to understand this mess.
Yeah, Glenn is really on to something here with this, and I know they're going to do well. Just 2 others I want to mention quickly. Cedar. Cedar is a company that a lot of people may not know about. They are a company that basically works in a very consumer-friendly fashion, end-to-end on the connecting the patient and the provider through revenue cycle management, in particular in the billing and the collection side and the payment side of a patient financial experience for care, which obviously is a monster issue. With the prices and also with so many people going to collections. So a few of their stats, they've got almost 90% patient satisfaction. Remember, these are patients that are paying money out of their pocket through their application, through Cedar's app and service. 70% of the payments are digitally self-directed and self-service payments, which eases the administration burden on the hospital and health system. 75% of the patients avoid the collection process by working through Cedar, 3 out of every 4. And of course, the health system and medical care providers are getting paid. The last thing is that it just happened a short time ago that Cedar acquired a company called, I'm going to pronounce it hopefully correctly, OODA Health or OODA Health, OODA Health, on the payer side, for about $425 million and change. And what they're looking to do in this next step, Don, is to bring together the provider and the payer around the consumer and patient financial experience. And they're also going to get into different touch points. They're going to get into, pre-auth. They're going to get into a lot of other areas. But Cedar is one to look at too. I would take a look at them if you're looking for something consumer friendly. And then the last one I have is a friend of mine, actually. Her name is Dr. Kristen Dickerson from Houston, Texas. I don't know if you've heard of this company. She has a company called Green Imaging, and they've got about 1,200 locations around the country.
Oh, wow.
Really smart model. What Kristen has done, Dr. Dickerson's done, is she's recognized as a radiologist herself that a lot of people with ridiculously high deductibles and high copays and whatnot can get drastically lower priced imaging by using dead time or downtime at
Oh, right.
independent imaging facilities.
Yep.
So she rents the people, she rents the space, she rents the equipment, and basically she contracts in through self-insured employers, through unions, that sort of thing, and offers this to people. Where instead of paying $1,500-$1,800 for, let's say, a single area MRI, they're paying $400.
Right.
And it's because, and then of course she pays part of that back in terms of rent. And she's just taking advantage of the downtime in these independent radiology facilities,
Right.
but she's doing it smartly, Don. So green imaging.
So you might go get your image at like 8 p.m. or something like that, where it's just not typical business hours, which frankly for a lot of people is probably a lot more convenient than taking the day off of work and everything else.
No, I mean they go pretty specific. They do it during 9 to 5 as well.
Oh, they do.
And they
Okay.
really have some. Oh yeah, they've got some really good algorithms on scheduling where they they feed in. And I mean, you got to be exact when you step in, but it really is a win-win for the consumers. So anyway, I just mentioned them because I think that's an area that I think largely is right for consumerism and for competitive pricing. It is the independent imaging facility space.
Very nice. Very nice. So great list of companies, and we're going to link, like I said, all of this stuff's going to be linked up down below for further research. And there's a bunch of episodes that we've done that are relevant here that I'm going to link up as well. As we look forward here, Steve, I'll ask you to be a little bit of a predictor, or just not predict, but tell us, what are you expecting to see? At least what are you positioning yourself to see, and positioning yourself to work with over the next couple of months, couple of years? Like, what do you think is happening here with consumerism? Obviously, you're excited about it. You think it's going to start to, at least, I suspect, chip away at the way things have been done here. But like, how quickly do you think some of this stuff really takes hold and starts to be meaningful? And I'll say, to quantify that, like, how soon will it not be weird for someone to say, oh, I need to go see the doctor, I'm calling Walmart, or oh, I need to see the doctor, I'm going to head into Target for a quick checkup because my foot is being weird today. Like, how far off are we from something like that to be common?
Oh, I think probably, in my opinion, I think 18 months to 2 years. And it's because not only does, and I know we're going to move into administrative costs in just a second, but I just want to tie this segment off here. There's going to be obviously some time needed for people to build up greater trust. I think it's not going to take 5 years, because I think if companies like Amazon and Walmart and companies that are non-healthcare companies, but have a long-standing trust basis for years with their consumers, I think if they can brand it, position it, I think if they can create the right types of grabbing commercials, I think it's, and obviously in the store, if they can weave into the patients touch points of welcoming them to the care, introducing them, I think because they have such trust with their patients already, with a big multi-decade start done, I think it's going to shorten the window from, let's say, 5 years down to 18 months to 2 years. It may be sooner, but I do think they have a tremendous advantage. Amazon, of course, has a tremendous advantage as well. So that's what I would see there. And I see companies like, let's say, GoodRX, which I know I ranted on a little bit. I see them, frankly, just growing from where they're at right now and continuing to ramp up, and eventually feeding into doctors, as you were talking about, at point of service. Once they turn that corner, they're going to get feed-in relationships that are going to really shoot them up. So that would be how I answer that.
Got it. Very exciting stuff. So administrative costs. We'll move there to round out this three-headed monster of price,
Yes.
cost, and administrative cost. And now, again, this is the thing about healthcare, is you can, kind of stumble into, $500 billion market here, a $300 billion market there, a $1 trillion market here. So let's talk about the $1 trillion market of healthcare waste that, and these are all estimates, right? But there are estimates out there that attribute nearly $1 trillion, you know, 25 to 35% of our overall healthcare spending to administrative waste. And this is documentation, this is prior authorization, this is utilization management, this is, on and on and on and on, all equality measurement and just compliance. There's so much stuff that anybody in healthcare, providers in particular, have to do to be allowed to provide care. $1 trillion worth of it, right? Like what is going on here? What can we do to start to cut into that just massive amount of waste, that whether it's $1 trillion or 500 billion or whatever it is, there's a lot of waste going on here. What do you see in this space?
This is monstrous. I have liked this space, and in particular, driving down admin costs, admin workflows, admin tasks like you're talking about. I would also add in, I'm just looking on my screen here. I mean, the list goes on, right? So prior authorizations is a biggie, eligibility, case management, denials, claim status. We'll get into it a little deeper when I
each one of these like poofs into existence their own mini industry, if you will. Like if you just think about the work being done in prior authorization alone, like just take any one of these slices, and now you've got another nice little tens of billions of dollars of market easily.
You do. So it's getting more competitive. I like. I know we'll talk about a few companies right here in a second. But one of the things, back in 2017, I attended a HIMSS seminar, a national seminar, and I remember that there was a breakout session. And the breakout session was AI and machine learning, but clinically. And of course, that is where, up until just recently, everything in AI has been centered on. Everything's been on clinical, like, reading for radiology films, and how can we do this for help with surgeries and all this sort of thing, which is great. But I remember having the discussion. It was between the Mayo Clinic and Watson, which of course you don't hear much about anymore, probably for, I won't get into that, but they had a breakout session.
We actually just talked about it on a show a couple weeks ago.
Yeah.
Whole episode.
Hundreds of people were at this breakout session, Don, and some media. At that time, I was kind of a media consulting person. And they opened up the microphones after they went on for an hour about how wonderful Watson's AI was. And they opened it up, and I remember there was a Watson rep there, a senior leader, and I stepped up to the open mic to ask questions because they opened it up. And I said, listen, I know all about the clinical and the great work you're doing there, and certainly appreciate it. What are you doing for administration? And honest to God, the room just went crickets, Don. Crickets. And the leader went crickets. And he said, what do you mean? And I said, well, what I mean is a third of all healthcare payments or costs go into administration and administration waste and inefficiency. Are you looking at that? That's a monster cost, area. Just nothing for a few seconds. It really was almost uncomfortable.
Yeah.
And that started me thinking about this space. And I have to tell you that now 90% of hospital leaders, healthcare leaders, have some sort of AI plan in place. Mm-hmm. And a lot of it is now starting to feed into the admin workflow. So, Don, one of the companies that I really love in this space is Olive. I have to say that I've been following them for some time. Candidly, I know a number of the leaders there. I'm connected with a number of leaders there, and for good reason. This company, in my opinion, really is doing it right. What they've done is they have looked at this issue at a very nuanced perspective by looking at administrative tasks and workflows in a number of different areas. So they break it down, and I'm just looking off to my screen here for just a second here, But they're looking at things like revenue cycle, supply chain, pharmacy, hospital pharmacy rather, staffing, operating rooms, and they're getting in shared services. They're getting into all of this. And what they're doing is using robotic process automation to go in and look at every nuanced human interaction point within these admin workflows. So, for example, if you're in, let's say, revenue cycle management, it's not just billing the patient. It's maybe there's 25 steps involved in actually billing a patient. A click here, sending something there, storing a file here, printing off something here. All of those things individually can be put into a robotic process automation with machine learning and deep learning, where not only does it replace the human hand, but what it does too is it actually learns as it goes through. So just imagine thousands, hundreds of thousands of these robots, Don, essentially working in all different admin tasks and components of tasks 24/7, 365. And I think Olive is in something like almost 700 hospitals now. I mean, they're really ramping up.
Yep.
And then they've got this, I guess you would call it their enterprise package, but what they do is they have something called an alpha site where they go into the health system and physically have an entire wing or room that is all computerized. One entire wall, one monster wall is nothing but a video screen. And it has all the stats real time of every little thing that they're tapping into robotically. Does that make sense?
Yeah, absolutely, it does. And that real time feedback is something not present in healthcare today. Certainly not from an administrative standpoint.
No.
Outside of that, so that's really impressive.
No, it's what they're doing essentially is not only taking a smart technology and a smart strategy, but what I love about the company too is I love the way they frame this. They're almost making Olive, by giving Olive a pronoun of she, what
Yep.
she's doing. They're really softening this exchange where essentially what you're doing is you're bringing in an AI workforce. You are driving up efficiency on the admin side. You're driving down costs. You're certainly driving down errors.
Yep.
And you're increasing capacity. But the flip side of this, which I love as well, is you're allowing the hospital now to retrain, redeploy their human assets from the admin side into the care side, where care and patient experience and all of that is so sorely needed. So I really like where Olive is going for so many reasons. I expect them to be a monster player, and I expect them to continually grow through 2000 for the next several years. I think you're going to see a very quick ramp up. And another player I would mention very quickly is LeanTaaS. That is an AI company that works on. They use lean principles and predictive analytics to focus on scheduling, Don. And they particularly, they're in, I think, 12 of 20 top health systems. And they look at things like inpatient scheduling, scheduling around MRIs, scheduling around patient flow when it comes to infusion centers, right? So they're smartly able to go in on this and really drive up revenue. And they're like they've driven up revenue like so many dollars per operating room per year. That's the way they measure these things. And they're also driving down patient wait times as much as 50%. So
Nice.
LeanTaaS is another one in this space I like. There's a bunch of others, but Olive and LeanTaaS are the ones I'm keeping my eye on. And frankly, Don, this space is ripe for change. And I think that this is a good investment of money, and I think it's a good investment too for people that are following the industry.
Yeah, right on. And this is honestly where I've spent the majority of the last 20 years of my life, is on this administrative side. And I'm all in on fixing this aspect of healthcare because it's a non-value add. Like this is potentially upwards of $1 trillion that is being spent that is not directly adding value. It's trying to solve other problems. And if we can clean it up and create some space so that we can actually solve the root of the problems, I think that's huge. And I'm pretty excited about some of the work that Olive is doing. There's some really great people that I know that are working there and are driving these products. And one that stood out to me that I don't know where they're at in the pipeline on this, but I saw their CEO talking about their 5 kind of current objectives. The one that stood out as just really powerful when you started using these tools is this idea that with all of, as he puts it, you said they talk about Olive as a her, with Olive watching all of the way that bills are being paid and all of these interactions across the board, she knows which bill's going to get paid and which bill's going to get denied. So the ones that they have a high confidence level on, they're going to pay doctors instantly on. When you talk about bringing down your AR time, like it goes to 0 for a vast majority of stuff, because a vast majority of stuff is pretty straightforward. It is pretty routine. And, so to be able to look at the data and to use it and to be able to understand what is most likely going to happen and then be able to act on it, it creates all kinds of new opportunities that just aren't there today. And, to your point, you opened this segment with talking about, IBM Watson Health. We just had a conversation about them a couple of weeks ago with Patty Padmanabhan about, they came out years ago and they made these big proclamations and they were going after cancer and all this stuff. And then, the reason we were talking about is because then a story broke in the Wall Street Journal that there's rumors that IBM's talking about divesting the whole unit. And it's like, well, what's going on here? What does this say about the state of AI in healthcare? And we've been talking a bunch about it lately on the show, both with Patty. We had Josh Meerman on from Blue Orange Digital recently. And everybody that we're talking to, Prashant Natarajan's been on a bunch of times. They're all talking about administrative. Right. Like there is good work being done in imaging and in dermatology and things. There is care work being done. But everybody that we bring on to talk are like, oh, we're making big headway in admin. We're able to streamline processes. We're able to find this because they're able to look at this massive amounts of data that no human could ever sit there and digest and make decisions from. And they're able to make those decisions and, predict, with probability, it is most likely this is going to happen. So let's assume it is and take our chances on an administrative side, right? And you can do that with admin. That's what makes care harder. You can't do that with care. Right? You're going to kill somebody. You're going to get sued. Like bad things are going to happen. That's a whole different animal. And I think that's what we talked about. That's probably, kudos to IBM and Watson Health for trying to drive this agenda, but maybe bit off a little more than they could chew this early on. Go after these things that are solvable, and that's what Olive seems to be doing, is going after this, more low-hanging fruit of administrative work that AI and more specifically, like you said, the remote process automation and machine learning techniques can have an impact on today. And that is happening, and that's really exciting. And if we could take it from $1 trillion to 700 billion, maybe, that'd be really nice. Now we got $300 billion that we could address social terms of health or something, or lower premiums or whatever. It's a big chunk of money that the system at large can do something with.
And just to connect that circle, Don, and you said it, and I loved how you said it. Ultimately, and I don't want to harp too much on pricing, but ultimately, there's going to have to be some give if we're going to make healthcare more affordable, and that give is going to have to come from pharmacy, from providers, and from payers. So, it's going to be interesting to see when you have all that extra money in savings, are you going to bring any of it back in terms of lower pricing, or are you going to keep it all as profit? You know what I mean? Or
always
reinvest
the question.
Yep. Yeah, that's
we're going to create gaps. What are you going to do with those gaps?
Very big.
If we make things more efficient for the doctor, are you going to let them spend more time with their patients, or are you going to cram in 2 more appointments? Because if you're just going to cram in 2 more appointments, then you've really just made the problem worse. So I think that's a great way to end, and it kind of brings this thing full circle. Is it it all sounds wonderful, we want it all to happen, but these are really, really difficult problems to solve when you step back and you take that Kaiser Soze view like you described earlier, and you look at the system as a whole. There's no easy answers, and there's a lot we got to take into consideration, but good stuff happening, right? You know, like
Yeah.
it doesn't happen overnight, and there's progress being made. You mentioned a ton of good companies. We're going to link them all up. We're going to link up your good work and your profiles and all that stuff down below. And you know, just been a wonderful conversation today, Steve. Thank you for coming on to do this experiment with us, which didn't quite end exactly perfectly. The end of this will not have been live streamed, but hey, that's how you learn, right? You experiment and you move on. So thank you for that. Thank you for your patience with all the setup and everything. Much appreciated. It has been a ton of fun talking with you today.
Yeah, I pleasure all mine, and really enjoyed it. So let's do it again in the future, and just really enjoyed it. Thanks so much.
Awesome. All right. And to you, the listener, you can check us out at thehcbiz.com. I'm Don Lee for the HC Biz Show, and we'll see you next time.